Hi, I'm Dr. Ange Mack. Welcome to my latest short video. And because this is Memorial Day weekend, I am going to focus on all our fabulous veterans out there. And thank you for those that have given the ultimate sacrifice. You are not forgotten. And also thank you to all of those who have sacrificed so much. Today, specifically, I'm going to discuss perimenopause and menopause and why these conditions can impact women veterans more. And not that all women are impacted during the perimenopause and menopause phases of life, which we will all go through. It's just that there are different drivers with veteran women. And this is what I want people to understand. So I'm going to do about 5 minutes on why these differences are here, why it matters, and why you as a veteran woman need to recognize these so you can share them with other women and with your healthcare providers so they understand how to treat you. And if they don't understand how to treat you, then let me know and we will work together to help them understand. That's part of my work here with Dr. Ange Mack. I'm not only educating and advocating for women, but I'm also educating their healthcare providers so they can get the treatment they need and they deserve. So first of all, with veteran women, we go through a certain type of training when we join the military. Usually there's a lot of load bearing because you have rucksacks, you're doing ruck marches sometimes in boots that don't quite fit and are hard on your feet and your legs and your joints. So that's one of the number one things that could be different between a non-veteran woman and a veteran woman. We go through very physical, hard training. Some of us continue that throughout our military career, and we have to recognize that training early on impacts our bones and our joints and our ligaments and all of those tissues that are impacted when we go through perimenopause. So let me back up just a minute. So perimenopause is the time in a woman's life when their progesterone and estrogen and testosterone start to diminish. We're going to focus really on estrogen right at this moment because estrogen can start going down and up and sideways, and that's why women will start having missed periods, longer periods, more flow, more symptoms, and may experience mood changes, insomnia, start to feel night sweats. And here's some other information that you may not know with regards to perimenopause. If you had children and you had postpartum depression, this likely can come back during this phase. If you are prone to depression or have a diagnosis of depression, then perimenopause and that drop of estrogen can hit you much harder. So please be aware of those things. Don't ignore them. Take care of yourself. So the musculoskeletal system impacted from all the hard ruck marches and work that you've put on your body. Having issues speaking today. I will do my best to get this information out there. So one, let's not dismiss that, and don't let your doctors dismiss it and your orthopedic doctors dismiss it if you're having knee problems, bone problems, joint problems that could be exacerbated with the drop of estrogen and testosterone and progesterone. Some other potentially service related conditions, hypervigilance. So when you're in the military, it doesn't matter if you are deployed and behind the wire or in front of the wire, there is a lot of hypervigilance that's required because you have to do your job. You have to protect your fellow soldiers. I was in the Army and the Air Force. You have to protect them. You have to protect yourself. You have to do the mission. You have to be on 24/7 so much of the time, and you do not know how to deregulate. So that hypervigilance gets you in a state of hyperarousal, high cortisol, high stress on your adrenals. All of these things can impact you later on in life when you're going through perimenopause. And to be clear, perimenopause is that time in a woman's life when their hormones, estrogen, progesterone, start to fluctuate. Menopause is the time in a woman's life when you've gone 1 year without a period. So really, in my mind, you have perimenopause, usually starting around in your 40s, sometimes earlier, but definitely usually in your 40s, you start to experience these drops in hormones. Menopause is 12 months after you have stopped having periods. And then there's postmenopause. So we have perimenopause and postmenopause in my book. So kind of those two. Menopause is just kind of a catch-all term. So let's know where we're at, first of all, ladies, and then let's know how to effectively assess ourselves and get the right treatment and support. So hypervigilant, number 2. Post-traumatic stress disorder and military sexual trauma, those are two issues that are real, and if you've had experiences while you're in the service that have caused you trauma, and I'm talking here big traumas, depending on if you went to war and the things you've experienced, or if you've had military sexual trauma, big trauma, these things can sometimes simmer, especially if you haven't had treatment, and then once your hormones start to fluctuate, they can bubble to the top and impact you hard. So we really want to be paying attention to our emotions here. Don't overlook them. Take care of your health. In addition to big traumas that can cause PTSD and military sexual trauma issues, you have little traumas that can impact you all along the way throughout your career. And I don't want to get into all the details of what these little T traumas are, but they do impact you. I'll do a longer video on that later. So again, please pay attention to yourself and know how to take care of yourself. So the big 3 again: musculoskeletal trauma, trauma on your bones, your muscle, your joints. When you get into perimenopause, then you start to lose bone density, you can lose muscle, and it can have a lot of trauma to your joints. There's something called 40-year-old shoulder. It's when your shoulder will freeze up. It's called 40-year-old shoulder for a reason, because that is when it starts to happen. And understand this is hormone related, and all of these things can be treated, if not prevent. I'm all about prevention, but if you're already having a lot of these symptoms and health conditions, then we're going to look at treatment, and holistic treatment is the way to go. Again, please take care of yourself. Understand musculoskeletal issues can creep up on you. You may dismiss them yourself if you're an athlete and you're used to being very active and you just think it's one more pain or one more issue. Know that during this time period it could be more than that. So pay attention. The hypervigilance, if you've been a type A personality your whole life and you've been in high stress jobs, and yes, I'm talking about military veteran women, but this could be really for any woman as well. If you've been living in this high state of hypervigilance for so long you don't know how to bring yourself down, this can exacerbate your depression, your insomnia, your weight gain, all of these issues that start to come about in perimenopause. Can start to creep up on you, and what I'm discussing are issues that can exacerbate these symptoms that will be potentially coming upon you. So musculoskeletal, hypervigilance, trauma. We need to take care of ourselves. I want you to recognize if you have these things going on. I'm going to put up a slide that really outlines what is going on with a military woman and the drivers that can exacerbate her symptoms during perimenopause and menopause. If you have any questions, I want you to reach out, drangemack.com. Go to my website, get a free consultation. If you have quick questions, just message me and I will respond as soon as I can. Again, I'm here to help. I'm here to help the women. I'm here to advocate for you because we've lived many lifetimes of being dismissed and ignored. And because our physicians are not trained as they should be in the areas of perimenopause and menopause, I work with them as well. So let's all work together. Let's get you healthy. Let's prevent the onset of some of these health conditions that are preventable. And I look forward to talking to you next time. Have a great Memorial Day weekend. Take care. Bye.